honey. Have a good day at school.
Thank you.
Oh, wait, Sally.
Yeah.
Don't forget your seizure med.
Oh, thank you.
Bye, sweetie.
Bye.
Have a good day.
Do you or someone you love suffer from a seizure disorder? Have you tried all of the traditional anti-epileptic drugs with no relief? If so, this commercial is for you. Over 25% of seizure disorders are refractory to first-line anti-epileptic pharmacotherapy. This leaves patients in need of an adjunct therapy to control seizure frequency and severity. Over the years, there have been numerous alternative therapies that have been studied for the management of seizure disorders.
Hello.
Hi, Mrs. Hernandez. This is Jessica. I'm the school nurse working today, and I'm here with Sally. She had another seizure again and needs to be picked up from school. She is not feeling too well.
Oh, my goodness. Okay, I'll be right there.
Okay, so I see that Sally has tried multiple medications and she's still having her seizures daily. Are you open to any additional therapy?
Yeah, I'm open to anything that would help Sally. I've heard about the ketogenic diet. Is that something we could do?
Yes, that's an option. Research has shown that children with daily seizures that have failed to respond to at least 2 anti-epileptic drugs can benefit from the ketogenic diet.
Okay.
Many children experience a decrease in seizure activity, and some have up to 50% decrease in their seizures. And few of them have also had complete resolution of their seizures.
Okay, but are there any side effects with that?
The most frequent side effects are reported by people are constipation, vomiting, lack of energy, and hunger. However, the side effect severity rarely leads to diet discontinuation and can be treated symptomatically if they do occur. We'd make sure to supplement vitamins and minerals if you were to choose this option, as deficiencies have been reported. We'd also keep an eye on her lipid levels as well.
Okay, and what does ketogenic even mean? Like, what would Sally have to eat?
Yeah, so that's a good question. The ketogenic diet is essentially a diet that has a higher proportion of fat than protein and carbohydrates. So a classic diet would have 75% of the calories coming from fat and the rest coming from carbs and proteins. So these foods with this type of ratio include eggs, fish, cheese, nuts, butter, oils, heavy whipping cream, and that's all integrated into like recipes like pancakes.
Ooh, pancakes,
Pancakes.
Sally. Yum. Okay, that sounds like a great option. Is there any alternatives though?
Okay, that's a really good question because there has been a lot of recent research on cannabinoid, which is also known as marijuana.
Oh.
It's the medical marijuana. It's called Epidiolex, and it's a new FDA-approved preparation of the cannabinoid that is approved for the treatment of Lennox-Gastaut syndrome and Dravet syndrome, and it's actually shown to reduce the frequency and the severity of seizures when compared to placebos.
Okay, and what are the side effects of that? I mean, you said marijuana. Does that mean that she's gonna have to smoke it?
Actually, the Epidiolex is an oil preparation that should be placed under the tongue for oral mucosal absorption, and it has 3 times greater effective absorption than oral.
Okay, and I've heard that marijuana causes anxiety. I mean, is that something that we need to be worried about if she were to take that?
Yeah, that's a good question. So the cannabinoid oil should be a pure cannabinoid and it shouldn't contain any amount of THC, and that's the psychoactive component. And when you're using the cannabinoid therapy, highly purified and regulated forms of cannabinoid are administered. So the common side effects of that are sedation, diarrhea, and loss of appetite. And additionally, patients might experience somnolence, fatigue, lethargy, fever, and vomiting. So these side effects are similar to side effects of traditional anti-epileptic therapy that Sally has already tried. However, these side effects may occur at a higher rate with patients using this Epidiolex.
Okay, thank you. Those both sound like great options. We're gonna have to think that over, but I just want what's best for Sally. Thank you so much. You've really given our family hope.
If you or someone you know suffers from a refractory seizure disorder, speak to your healthcare provider about an appropriate adjunctive therapy. Do not start these adjunctive therapies on your own. Follow all of your provider's instructions and do not discontinue abruptly or without healthcare provider knowledge.